Hi, good evening everyone. This is just a quick video on how to use your remote access laptops. I'm sure you'll manage just fine, but just in case there's any technical hiccups, this might save a lot of time. This is March 2020, the 21st. My name's Muntrin Ansar. I'm the GPE Health Lead for NHS Fife. I've just recently been appointed, and it looks as though we're now in the deep end with the COVID crisis. So let's get started, and good luck to you all. Stay safe. So here we go. You just press the on button down across here. It brings you up to this. When you're first switching on for the first time, it won't connect in your own house because you need to connect it up to the Wi-Fi. It's all fairly straightforward, so I'll just pull you across to so that I'm not publishing my password to the rest of the world. Let's do this. You'll see it says log on. Make sure it says FAHT. It's case sensitive, as you know, exactly the same as what you would do in your practice. Fairly straightforward when it works. We've had some teething problems, but I think we're nearly there now. And then most of the computers will have a separate folder that you don't see on mine. You will see some EMIS icons and things like that. Really important. Don't click on any of those EMIS icons. You must click into the folder that basically says something to do with servers. You double click on the folder. You'll see before you do that, you're seeing this thing called VPN. Sometimes you'll see it will ask you to type in your username and password. And if that happens, it's just your Windows username and password that you put in. You will see here, it says that talks about single sign-on is automatically set. So what we'll do now is we will try and dial into the server. So like I say, that normally for most of your laptops, there'll be a folder. You double click on that folder, you'll see a whole list of practices across NHS Fife. You click on your own one. My one is set up very, very slightly differently. It will then say connecting to your server. So once you connect to your server, it's really important you recognize that there's a small toolbar across the top, or menu bar, whatever you want to call it. And you will then start to see some familiar icons, hopefully. Docman, EMIS, and so on and so forth. Let's see what happens. So let's click Docman, just to open up Docman. Sometimes it will auto-populate, occasionally it won't. Some users get problems whereby they have to type in the username password themselves, or it gets it back to front. It's not a major problem. And then we just literally double click EMIS. It's all self-populating quite nicely. The whole IT team have been working day and night to try and get some of these equipments out to yourself, so please bear with them. So let's log in and see how we get on. This error message, quite normal. It's to do with script switch. We've not switched it on, and the reason for that is just not sensible in this type of remote working setting, we think. So let's just log in. We'll see how we get on, take things from there. All fairly straightforward. A couple of do's and don'ts. Here's your appointment book. We won't break any confidentiality. We'll just open up Mickey Mouse. Let me do that. Here we go. Right, so I've opened up Mickey Mouse's file. Here we are. Let's see, it just works exactly the same way as everything else. So here we are. Just click OK. Where are we? There we go. You can see your problems list. You can see your Docman. The Docman theoretically links very nicely. Says here, we were just doing some test picture in our practice of someone's foot. It's one of our secretary's foot, I think. Anyway, so let's have a look. Do's and don'ts. Remember that you are dialed into a server. So theoretically, when you're adding a prescription, let's try and add a prescription. This is how I normally do it. We press F9 and we don't press print for the prescription. So we'll just add, and we can type in the drug that we want. Amoxicillin. let's do this. And then we press next. Don't press issue, press next again, and then press cancel. You'll then see it up here. What we then tend to do if you're working from home is that I'll commonly then send a message to one of my receptionists to say, look, I've added a prescription for so-and-so, please can you print it out and ask someone else to sign it, and normally ask them to acknowledge that they've received that message. So that's pretty much it. It's fairly straightforward. So don't press print, otherwise it can cause the system to freeze. So let's get back to the main screen. Remember, unfortunately, that you can't print from these laptops once you're logged into the server. And also a very important point is that if you're using any Connect, your microphone will not work and your headset will not work at this moment in time. And that is because you're dialed into the server. So if you're using any Connect from home, you will unfortunately need to use an iPad, one of your own personal devices, to do the video consultation if you want to keep the EMIS window and DocMan window open. I think those are the main things I can think about it. I can't overemphasize how important it is, rather than click here directly or just start shutdown, is that always get into a good habit of just closing the windows. It saves the system getting muddled. Quite an important point. Once in a blue moon, sometimes things don't work out the way that you want to do things. And then sometimes with EMIS, if EMIS is not loading up properly, if you right click and run as administrator, sometimes that will fix some of your problems. Remember, a couple of tips with any Connect. Obviously, you're not going to be using it from EMIS when you're working from home on the same computer. You do need to use Google Chrome or I think it might be Firefox, but certainly not Internet Explorer, because it doesn't work with Internet Explorer. Same pitfall applies with when you're using MS Teams, which is up and coming and used very frequently in other sectors. That allows you to video conference with MS Teams. Again, if you want to use MS Teams to link into your practice, join a video call, you have to make sure that you are out of the practice server. So let's close off these things. It's just doing something. Now let's close off DocMan, log out and close. So theoretically, whilst the temptation is to go onto Google Chrome or something like that, and then or double click on MS Teams, the microphone will not work. The only workaround around that is that you have to close this window and then get out of that. I think those are the main points that I can think of. Where possible, try, if you can, change your passwords on your home computer, not your home computer, sorry, your computer at work, especially your Windows password. Occasionally system gets a little bit muddled now and again. It's not normally a major problem. And that's really all I think I need to say. If you've got any questions or queries, you've got the contact details for the eHealth team, who of course are very, very busy during this time. We all wish you well, and obviously all of us will be in the front line, so we just hope for the best, and we can use technology to our advantage, hopefully, to make sure that we're all able to communicate well and effectively and quickly with each other. So I think on that note, I will leave it at that. I don't think I can think of any other important points today. So essentially, take-home messages: always close EMIS, always close DocMan, log in via the server. Don't click EMIS directly until you see this. Once you see the menu bar, that's fine. You're always going into the server. Basically, you can't print when you're adding prescriptions. You know what to do. Don't press print. Sometimes for efficiency for remote access working, keep a note of which patients you've decided to add prescriptions. Maybe phone one of your prescriptions team directly, bypass the work phone number and just ask for the person's, as in your reception colleague's mobile, and then give them a list of instructions. That's it, really. All the best. I'm Muntarin Ansar. Bye for now. Take care.